All right. Thank you, everyone, for coming to the third out of four coordinated transportation planning meetings. My name is Sharon Pearson. I am the Lorain County Mobility Manager, and my job is to work with and collaborate with various transportation providers, government agencies, and nonprofits, other organizations to improve our transportation in our county. There are 40 mobility managers in the state of Ohio, covering 2/3 of the state. So this is not something new here in Lorain County. We're doing the rewrite of this plan because it's something that we need to do. We need to rewrite it every 5 years, but also we update it every year as well to determine whether or not the goals that we have established have been successfully achieved. But what we're doing here today is looking to improve or to rewrite the goals to determine if the current goals we have, are they still sufficient, or do we need to write new goals? And this helps us to continue to get the funding for the mobility management program, but also for any transportation providers who are looking to purchase vehicles to help us with improving transportation in Lorain County. So in the past, I've turned off the caption, but I'm going to leave it on for those who may not be able to hear everything so that they can easily see what we are saying. So let's see here. Let's see if I can do this. Nope. My lovely assistant, Matt, is going to help me here. So I want to thank the Nord Family Foundation. They have provided the funding to offer the refreshments we have today, and also provided the transportation for people who didn't have a way to get here. So we really appreciate the fact that they did that. Next slide. Also, we are recording this meeting. ODOT requires that we have these meetings in person, but we do record it. So if there are people who weren't able to make it today, which are probably quite a few because of the weather and other things, you can go back and listen to it. It will be located on the moveloraincounty.org website for you to take a look. And I will be sending it out in the newsletter. That's the reason why we did ask for your email addresses. So we're going to add your email addresses to our newsletter, so you're getting the updates and information about what we're doing. Next slide. So this is the agenda. I'm going to kind of recap the June 13th meeting. We're going to listen to an interview from a resident in Oberlin about his experiences with transportation. Matt Brady, my lovely assistant here, and my coworker, is going to go over the transportation survey results. Lauren K, I can't say her last name. Good job, Lauren. Yeah, whatever. I still can't say. Is going to recap the part of the SWOT analysis that we were able to accomplish last time. So we're going to go over the strengths, weaknesses, and opportunity. We're going to look at a transportation solution, because that was one of our requests was, okay, we're talking about all these problems, but what else can we do? So I want to show you a sample from North Carolina, but also later on one from Toledo. So something local. We are going to break out at the end and finalize the SWOT analysis, looking at the threats. Do 10 minutes of that as well. Gosh. Okay. Let's stop looking outside. Okay, next slide. So recap. So what we did last meeting is we did hear a presentation from a lady who lived at Metropolitan Housing in Elyria. She did have a car, but she had a lot of experience with the people around her and the struggles that they were having regarding transportation. She has a niece that she's picking up that lives over at Colonial Oaks, but works at Rydell. And her niece has a coworker that has to walk from near Lorain County Community College over to Rydell at 4 a.m. in the morning. And then she comes back at 1:30 in the afternoon. We always hear people don't want to work, but let me tell you, that's dedication. She's walking in the dark to get to work. So that video is available online to be able to look at if you want to see that again. We also looked at the preliminary findings from the transportation survey and the focus groups. Hopefully the lights won't go out here. This is looking rough. And then we did some small group discussions looking at going over part of the SWOT analysis. So the next slide. I want to thank Lorain County Transit because they added bicycle racks to their buses. And last time I was on the bus with folks from North Center, there was a lady on there who said, thank you so much for those bike racks, because I've been on the bus and people brought their bikes on the bus and it was rolling over my foot. Because the bikes were in the aisleway and it was hard to get out. Alexis, you were on the bus when we first saw that. It's because of Alexis and Mike Longo. We were on the bus and we saw two people get on and they had to put their bikes right in the aisle. And we were looking at that going, that's so unsafe. If there was an issue, there was no way for people to escape safely. And so we asked the commissioners about getting these bikes on the buses, and so they were able to do that. What was really great was that Kira Williams from Lorain County Public Health
it just jumped on it.
Kira Williams from Lorain County Public Health, who works on active transportation, was on the bus at that time, and so she was so excited. She's the one who actually supplied me with a lot of these pictures, because she jumped off the bus and took all these pictures. She was so excited to see this, and it really gave her more insight about how transportation and active transportation really relate to each other too. So next slide. So this also Lorain or County Public Health, along with Elyria and Lorain, were able to get funding. Here we see Kira now, from Safe Routes to School. This is just a short little video that I want to share with you regarding the amount of funding that they received.
Grab a chair. Zen flash here.
All right, push the. Cities that received money. Oberlin did, it was there,
And Clearview City School District.
and Clearview City, yeah, so that's over $1 million that has come into our county. So thank you, Lorain County Public Health and the other communities for their efforts on that. So that's really great. Next slide. So I want to go over what our current coordinated transportation plan goals are. These are goals from 2019 to 2023. One is to increase awareness of transportation options. That's a result of the fact that our first survey that we did, we received over 700 responses, and half of them said that they were not aware of what their options were in Lorain County. Second was developing the mobility management program. The position that I have right now is the first for Lorain County specifically that we've had. The mobility management program has been around since for 2008. Or so, but it was the first one of its kind, so we needed the time in order to understand how this program was going to work. Then it explored data collections and planning synergies. This is really about collaboration efforts and being at the table where transportation is most likely to come up regarding economic development. It's also about survey collection, also about focus groups and getting that information out there, and then talking with government agencies and others who are planning things to let them know about what we're hearing from the general public. Coordinating educational training programs that's helping people learn how to ride the bus, but it's also about what about all the drivers that we have in Lorain County. Sometimes what we're finding, and Ed, you can tell me if this is true, you have to go to Columbus sometimes to get some of that training. Is that correct?
Yes.
You know, is there a way for us to be able to have that training here locally for the drivers? So that we don't have to travel that far. So there's two sides of that training, and then exploring transportation pilot projects, which we've done a few times here, to be able to understand what works and what doesn't work. And we've learned quite a bit from the pilot programs we've done. Any questions about those goals at all? Okay. So next, I want to have you listen. It's about 10 minutes to Mark Dumas. He is from Oberlin, and he has used public transit on and off for about 20 years. So go
Where
ahead.
is it that you live?
John Frederick Oberlin Home High Rise.
Okay.
Yeah, high rise building, LMHA high rise building in Oberlin.
Okay.
Yep.
And I don't know if you mind telling us how long you've been here.
I've probably been here for around 20 years.
Okay. All
Yeah.
right. So tell us about transportation. What are your memories of transportation, you know, since you've been here for 20 years, you know,
Well,
in the past?
Well, I haven't had a car for a long time. And my transportation needs, I used to do the LCT bus when they had routes. And I can't remember if that was while I was still working, living here or not. I'm from Oberlin, so my memory goes back for a while.
Okay.
But that stopped, and I had to start using LCT Dollar Ride. And I've been using Dollar Ride to go shopping.
Okay.
I used to use that to go shopping for my mother and go shopping for myself. And also, more recently, I mean, I still use it to go shopping, go to Walmart, places like that. And IJ sometimes, mostly Walmart. I also used it for my mother, to get my mother to her appointments in Oberlin at the clinic, and different things she needed to do. And then after she moved in with me, I was doing the same thing, getting her to her doctor, getting her to her foot doctor, getting her to her regular primary care doctor. I used to not like the Dollar Ride. My mother said, use the Dollar Ride, use the Dollar Ride. I said, Mom, I don't want to do that. You know, I was using back when we had routes. You know, I could go to the mall and shopping around there, walk around, shop, and get what I need to get for the most part, and come back home. Then that stopped, and all I had left was Dollar Ride, so I started using Dollar Ride, and it's very helpful because without Dollar Ride, I couldn't get my groceries, and that would be really hard. I can't go to Elyria anymore. Well, technically I can, but I'd have to take the Dollar Ride all the way down there. I also used it when I had my cat, to take my cat to her doctor and stuff, and different things I had to do.
So what is it that you feel is missing from transportation here in Lorain County, whether it be transit or other services?
We don't have a regular service anymore. We used to have a service where you had bus stops, but you could pretty much flag them down anywhere along the route. And that, for the most part, that usually worked pretty good. For a while, I guess folks were flagging them all over the place and it was hurting their schedules. But I could get on the bus. I could go to Elyria to the mall. Now the mall is not there. I guess it's pretty much closed down, which is really weird to me because that used to be a place I used to like to go. But I can't go to Elyria to do shopping if I wanted to go shopping at one of the larger stores in that area. I miss that because that was almost like having a car. Even if you just wanted to go down there to relax, you could do that. Now, I really miss having a regular bus scheduled service because back then you also had maps. So if you needed to go somewhere, you used to have a big old map and you can look and you have an idea of which bus to take. You know, that was a long time ago. don't have that now. So I miss that. Regular bus service, you know, being in Oakland is like being in a third world because you're away from everything that you really need to get to. Oakland's getting a few things. They got some dentistry down there, and we have a community center or community health place here, which is nice, you know. But if you want to,
Sorry.
if you want to do stuff, get to Lorraine or stuff like that, it's difficult, you know. I guess another issue too is a lot of people don't vote for the bus, and they look on the bus and they say, oh, there's just one person on the bus and no one uses it. But it's not true. We use it a lot. It's just not a lot of people at one time, you know. And a lot of folks think, well, you know, if that's the case, we don't need it that often, you know. But if you have nothing else, you can't use it that much. I'm basically free because I'm a veteran.
Right.
Even if I take the county counterpart to LCT or Dollar Ride and have to go somewhere a little further instead of the immediate area of Oakland, I don't have to pay anything. Now, I'm still not aware of anywhere we can get tickets around here, you know.
Yeah, I don't think that there is.
And you know, it's hard to find a job if you're here in Oakland, you know. I used to walk to McDonald's, and that was good for me. You know, I walked to McDonald's and stuff, and when my feet started going bad, I would try to catch the bus to get a ride, because I worked evenings, so I might get off anywhere from 11 or 12 or a little bit later. Well, I wouldn't get a ride if it's after 12, but he's around 11 o'clock, and I would get the bus back, and that would help me, especially when my feet and stuff would hurt, you know, and things are worse now. But all those little things that helps you get to where you work at. And even when we had bus service, I lived in Elyria, I think it was, and we used to have a guy who would catch the LCT bus, and he didn't like anybody talking or anything because he had just barely enough time. And so I think this was in Elyria several years ago. He would catch the bus, and then that bus would be heading towards Cleveland. Where I would go, I would get off. It's been such a long time, but I remember that he was going to a job at the Cleveland airport around there. They did inspected tires and landing gear for jets and stuff. And he would have just barely enough time because there wasn't enough buses, and that was a while ago, you know. If you need to work, it's really hard, you know, and especially if you're someone like me, who maybe I'm gonna be able to work again. I don't know. I had to get a sit-down job once I get through all these issues. I need transportation, you know, to go any job I go, you know, especially in the wintertime. One thing I will say about LCT over the past decades, or like 30 years or so, that one thing I admired about LCT is that during the wintertime, because I used to live in Elyria, and I had to take the LCT bus to North Ridgeville because I had a job at a plastic factory there. They would never, for the most part, they would never stop running. If they were behind during the wintertime, they would keep the buses rolling. So you're not left out literally on the corner, cold corner. LCT used to keep rolling. And that's one thing I appreciated. I only had to stay in the hotel like once, you know, because they would keep rolling. Even if they're an hour or two behind, they keep the buses rolling until they get everybody. And that's one thing I appreciate, even though this is a long time ago, maybe 30 years ago. That's one thing I admired about LCT. You know, today we need more routes. We need ability to be able to go and work. You know, that's the biggest thing. If you know, a long time ago, everybody was saying, "Oh yeah, let's get buses and everything." You know, you don't need cars. You know, and yes, you do. You know, you need cars. I mean, you need buses. Otherwise, you can't get to work. You have a hard time looking for jobs, let alone getting to it. You know, if my back permits me, I'd like to go bowling again, you know. Now, there's a bowling alley they got down by the hospital. It'd be nice to be able to go to that, you know, because I can't walk that far now. Little things like that would be nice, you know. There's a bowling alley in Wellington I like to go to. Of course, that's late at night, so you know, I may not be able to ever do that again. That's if I can bowl again. But little things like that, I like to be able to do, you know, and I can't do that. We don't have a bus system that will allow that. Well, Lorraine County, you don't have really good transit systems. I don't think there's much of anything in Elyria. The rain, that's cut down, and Oberlin is pretty much non-existent. Years ago, I was living in Portland, Oregon. They had a pretty good transportation system. I can get on that, go all over the place, you know, go to my job, go to places I had a storage and everything like that. Here, there's like nothing, you know, and you got people out in the country, they're trying to work and they don't always have cars, and without buses that'll go out in the country, they can't get to work either, you know. So what would I tell people who have cars? Vote when we have the opportunity to get money for transportation. You know, we need it, because when you lose your car, you're trying to find some other way, or you get sick and you can't drive anymore, you get old. You got to have some kind of bus to get you where you need to go, you know. We got a few buses now, but it's not much. If you want a person to have quality of life, you know, to get to even going to school to get training so you can get a better job, or remake yourself. If you want to be able to just enjoy yourself, go bowling, go to activities. I mean, we live in Oberlin. We got students doing what do you call those things? Recitals. You got all kind of activities here in Oberlin, and it's hard to get to. I used to be able to walk a lot, pride myself on being able to walk. I can't walk so far too good now. I mean, one good thing is they got all those chairs downtown, so I can walk a little bit, sit down, get up, walk a little bit, sit down. But it takes a long time. And you got a lot of activities where you can have quality life, even if you don't have a car. And without transportation, you can't get to them. You can't get to education. It's very difficult to get to jobs, even simple jobs, you know. If you don't have transportation, you can't get to that. And it's a bunch of baloney when people say, "Oh, we take buses. You don't need cars." Well, they're not. It's not working too well. Vote for bills and levies that bring us money for transportation, because being here, it's like being in the third world, especially once your health goes down.
So, just wanted to make sure that you heard that video so you can hear firsthand from somebody who struggles with transportation, and also to think about it as we go through the threats as well. I don't know if there are any comments regarding that video. Yes.
We transported, I'm with the Veterans Service Commission. We mentioned about transportation to medical appointments and that being a problem. We transported him quite a bit. Last time he was transported was on July 21st of this year. He's also on schedule for 9/26. So with him saying that he's having problems with transportation, medical, we're taking care of that for him.
Right.
So it kind of disappointed me that he never mentioned that I heard the Lorain County Veterans Service Commission is actually providing him transportation to his medical.
He did say that he's a veteran and he does get transportation, and I think there might have been a section that I might have edited out where he did mention that he does get transportation through you. So it was longer, and I wanted to make sure that it was kind of short.
Because calling Oberlin a third world is insulting to Oberlin. I'm not disagreeing that there's a transportation issue in Lorain County. There is, clearly. But to say that really I'm not from Oberlin. I don't have a nickel on that dime.
I am.
But to say that Oberlin is like the third world.
Well, the reason he's saying that, he's saying that from a standpoint of somebody who doesn't have a car.
Yeah, I get what you're saying, but still, I've been in a third world country before. Oberlin's not a third world country.
Right, well, he, you know.
Yeah.
We have to remember that these are people's perspectives, and I don't wanna necessarily say he shouldn't say that, because that's how he feels, and that's the reality. Because he doesn't have the transportation the way that he used to have it, where he had more freedom. So I understand what you're saying, but at the same time, I guess I want to take the opportunity to respect the feelings that people have. I don't want to argue against the fact that he feels that way, or tell them that he's wrong, but he did mention veterans and that he gets the free ride because he is a veteran. So yeah, he did say that in this video.
Okay, good.
He did say that. I want to recognize State Representative Joe Miller. I want to thank him for coming today and being here. I know he's going to have to leave and go out to the flooded area?
I don't have a boat, so I'm not going to the fairgrounds. It's about 4 feet underwater.
Yeah.
So the poor kids that were gonna get their animals auctioned today are gonna probably reschedule it. So transportation's changing down in that area where it's flooding. So.
So, I don't know if there were any other comments regarding this, or if there was some insight. Yes, he mentioned third world, that was probably a little tough, but that's his reality and the way that he feels, because the transportation has gotten worse in his view. Because he used to have a lot more freedom, be even able to get to Cleveland, can't do that anymore at all. So if not, we can go ahead and go on to the next. So we're gonna ask Matt to present. He's gonna talk about the final transportation, the data, the survey results, and also anybody who wants to, if you have questions and you want to see more live data, he can share that with you as well.
All right, good morning, everyone. So as you know, we do the annual transportation survey. We're gonna go over some of the results of it. It's a very robust survey, so we're not gonna touch on everything or even really a fraction of everything, but there's some interesting key points about the populations that we want to highlight this morning, and then just general things. We'll have a little bit of a section for you to see the overall results and chime in with comments, but this could be, this could be a 5-hour presentation. So it's going to be a little tidbit now, and then you can see the full results at a later point.
So let me go ahead and show that again.
All right. Are you able to advance the screen?
Yes.
Okay.
I can do that. Whoops, where am I? Where am I? There we go.
Okay.
Okay.
All right. So for this presentation here, we've segmented the data into 3 populations. We're looking at it with senior specific data, disabled specific data, people who have self-reported as disabled, and people who have self-reported as low income. We're going to look at a few different categories for each of these populations, and then just a little general overview and other findings after that. So to start, we're going to go with the senior population. So there were 405 respondents to this survey throughout the county. 148 of them reported being age 65 plus. 33% of seniors didn't know their transportation options, compared to 26% under age 65. So there is a little bit over the rest of the population who say they don't know their transportation options. 44% of seniors were concerned with saving money on transportation, as compared to 67% under 65, which I thought was a very interesting point, because it shows that seniors want to get where they're going, but don't necessarily care as much as the rest of the population how much they're spending on it, or at least if they're saving money on it. And then 55% of seniors self-drive, compared to the under 65 rate of 64%. 15% of seniors utilize private pay-per-ride, so Uber, Lyft, taxis, rideshare like that, as compared to 28% of the population under 65. 64% of seniors feel transportation options are meeting their need, as compared to 60% under 65, so it is slightly higher for that. Among seniors, availability and destination options were the 2 lowest scoring areas of public transportation satisfaction. So there was a question that asked you to rank through how many, like 10, 15 categories, what you're most satisfied with and what you're least satisfied with, or very satisfied, or not unsatisfied. They said the 2 lowest scoring areas for seniors were availability and destination. However, vehicles, so the actual vehicles themselves and the drivers, were the 2 highest scoring categories. And then the final slide for seniors. Among seniors, there was another question that asked about what changes could be made to public transportation that would make it more appealing for you to take. The 2, actually I think 3, because there was a tie, categories they said would be the most appealing changes to be made to public transportation were if I could ride to other destinations in other counties outside of Lorraine County, and if there was service on weekends / if it picked me up at my house and took me directly to where I'm going, no shared rides with others, were the most appealing changes that could be made in the eyes of seniors. As far as commonly visited destinations for seniors, medical, dental offices and hospitals and grocery shopping were the two highest scoring. Sharon, that's pretty consistent with prior years. That's very set in stone. 50% of senior respondents considered themselves low income. And then 9% of the seniors surveyed were employed outside the home or daily volunteers, so needing to get out of the house daily to fulfill those obligations.
And the Q7, I take it, referred to the questions
Yes,
on the
that's the
survey.
question number on the survey. Thanks. So that's after every one of these. We'll see the survey questions later. That just specifies which question this data is from. So next are the self-identified as disabled population. So this was 77 out of 405 respondents. 43% of them use public transportation, medical, senior services, as compared to 17% of all others. So I think this really shows that the portion of people who are disabled, that's still under half of them using it, but it's much higher than the rest of the population. So they probably by need have to know what their options are. 31% of those disabled self-drive as compared to 65% of all others. 61% of those disabled feel that transportation options are meeting their needs as compared to 62% of all others. So pretty in line with the general population. Among those disabled, pickup locations and destination options were the two lowest scoring categories, whereas safety and drivers were the two highest scoring categories. So you can see again, people really do like the drivers. Among those who reported as disabled, the most appealing changes that could be made were, again, if I could ride to destinations in other counties outside of Lorraine County, and if there was service on the weekends. The most commonly visited destinations, there were, I was trying to do the top two, but then there was a tie for second place. So we're looking at medical / dental offices or hospitals and grocery shopping. This one also having weekly medical appointments, dialysis, physical therapy, for example, as a tie for second place, as you would probably expect. And 94% of the self-reported disabled respondents considered themselves as low income. So now we're getting into the low income population. So 218 out of 405 respondents in the survey self-identified as low income. 22% of them didn't know their transportation options as compared to 40% not reporting as low income. 33% of low income respondents use public, medical, senior transportation as compared to 7% not reporting as low income. So I think that's a really interesting inverse there. In this survey, only 7% of those not reporting as low income were using public transportation, and again, this all goes to, this is the survey data. This is just exactly what we're getting from people who have taken this survey. 43% of low income respondents self-drive as compared to 86% of those who don't report as low income. So 86% of people not reporting as low income are driving, only 43% who are low income are driving. 57% of low income respondents feel transportation options are meeting their needs as compared to 67% not reporting as low income. Among low income respondents, the two lowest scoring areas of public transportation were availability and destination options, whereas safety and drivers were the two highest. So drivers swept this category, kudos to the drivers. And then those reporting as low income across the board were more satisfied with public transportation than those reporting as low income. Not low income. So I thought that was very interesting. In the category that showed the satisfaction with each of the categories, low income people were very satisfied, at least as compared to the non-low income. Among low income respondents, the two most appealing changes that could be made, again, riding to destinations outside of Lorraine County, and then service being on the weekends would be the most appealing changes. Two most commonly visited destinations, medical, dental offices or hospitals, and grocery shopping. And then of low income respondents, 33% were disabled, 23% were currently employed, and 22% of them were retired. This is just a little, what I see as an emerging trends section that I was able to pull out of the data. So kind of tech focused, and how things could be moving in the future. 51% of those under the age of 35 would be more likely to pursue transportation options other than driving if those options were better for the environment, whereas only 36% over age 35 said that. So again, you can see with the younger generations, they are getting to be a little bit more environmentally conscious, which could be something to really be aware of going forward. 53% of those under 35 would find public transportation more appealing if they could request their trip electronically, as compared to only 24% over the age of 35. So really tech focused. And then 64% would use a transportation smartphone app. That's of the total population. So of everyone that responded, 64% said they would use a smartphone app. 87% under age 35 said they would use a smartphone app, but still 45% of those over the age of 65 said that they would use a smartphone app, which I think that was kind of telling, because that population, it's really interesting to see that they would still use a smartphone app. So now I want to go into the survey results so we can just take a quick look over them. Any questions or comments as I'm pulling this up?
Or any insights or based on this data?
Insight wise, anytime I travel, I usually park my car and I usually get to use their public transportation. I have been to several states and the apps are usually very, very easy and they make my time there a little less stressful because, different laws in different areas, especially just recently in New Orleans, they had a nice piece in their app where the bus was. And I thought that was really unique and really cool and made my 6 days in New Orleans very, very smooth. So definitely answerable.
You're co-hosting. I probably need to stop sharing.
Well, and I think something that we need to pay attention to, as Matt pointed out, the responses from the younger generation, the under 35, because we are concerned about brain drain, right? We're concerned about our younger folks moving out of Lorain County and taking their success and their taxes elsewhere. So if we could find a way to attract those younger folks to stay in our county, by providing these transportation options, I can tell you, if I had a reliable public transportation option, I would not commute to work. I would not drive. I would use another source. So I really think that that's important. I'm really glad Matt pointed that out because that is something that we need to be paying attention to.
I'm just gonna, fixing some tech issues here. Get to it. I'll go the easy way and just do this.
Yeah.
No, it's free. But we all for the two and from VA. However, the VA scheduled an appointment for the veteran at the Cleveland Clinic for years in a private hospital.
All right. So to bring it back in, here we go. We've got the transportation data up from the survey. So we'll, again, quickly go through this. Sharon, you're able to share the full results of it at a later point, right? So we'll share the full results so you can really dive into it more if you want, but just a very quick overview of everything. So what types?
Are they seeing it?
Yes.
Okay.
Yep, I'm sharing it.
Okay.
What types of private, public, or eligibility-based transportation options have you or a family member used in the past 12 months? So non-segmented, you'll see self-driving. It's actually a little easier if I go down here, if you can see those numbers well enough. So majority, 58, almost 59% were self-driving with a borrowed vehicle, still leaving 41% not driving. Biking or walking, ride share, carpool with friends, just keeping in descending order, paper ride, some others, Medicaid, private insurance, fixed local route, Lorain County Office on Aging, fixed route cross country, and then Lorain County Veteran Service Commission, medical transportation. So do you feel transportation options available to you are adequately meeting your needs? We've got the why or why not answers we won't get into because that would take a few hours. But we've got 61.5% saying yes, 43%, almost 44% saying no. And I know those don't add up. I guess you could choose both yes and no, and some people did. So that's why those percentages aren't quite right. Is public transportation or medical senior services transportation an option for you? So we'll see 21, almost 22% say yes, I use it. 20% yes, but I don't use it. 16% no, it's not available where I live. 8% no, it does not go where I need to go. 4% saying not available the days or times that I need it. Only one person saying no, the vehicles are not wheelchair or walker accessible. And then 29% saying I don't know what my options are. And then no one's saying that it's unaffordable. If public or medical/senior services transportation is available, but you do not use it, please select any of the following reasons that apply. Majority of the answers were, I have my own car and prefer to drive. I guess not majority, 45%. Some saying I do not qualify, that I don't know how to use transportation available. My friends and family members driving me where I need to go, and then I can't afford it. So a few who said it on that one. If any other transportation option except driving were easy to use and available to you and or your family, which of the following would cause you to use the service? If it was convenient and easy to schedule, almost 60%. If it would save money, 57%. If I were not capable of driving myself, 56%. And getting under 50%. If I don't have another transportation option, were you about to say something?
Yeah, that people could choose more than one, so that's why it's not going to add up to 100% on this.
Yes. So better for the environment if it provided wheelchair or walker accessible vehicles, other, and then a very, very low amount of people saying I would not use public, private, or other transportation under any circumstances. Very few. Regarding, I won't get totally into this, but this is the satisfaction with all of the different areas. So you can see we had cost, availability, destination options, pickup options, drivers, vehicles, timeliness, scheduling, reliability, safety, and ease of use. These scores over to the right show how high overall the weighting was for those answers. Kind of going back to what I talked about for this segment in populations. The two highest scoring here for everyone were drivers and safety. And then a few pretty even below that. What changes would you make to public transportation? What changes would make public transportation options more appealing to you? Down here, top two answers were tied. If I could ride to destinations in other counties and if there was service on the weekends. Getting down below that, the next few top answers were if fixed route buses were available in my area or came more often, if it picked me up at my house and took me directly where I'm going, no shared rides, if services started earlier in the morning or ended later at night, if bus routes, bus stops, and bus schedules were easier to understand, if I could request my trip through an app or website, not just on the phone, and then if it was more reliable, on time, or picking me up, dropping me off. The bottom few answers here are, I am satisfied with transportation service options available if they offered wheelchair or walker accessible vehicles, and nothing could make transportation service options appealing to me. But only 6% said that, so there's hope. If a smartphone app was available to easily schedule public or eligibility-based transportation, would you use it? Yes, I would use it, was almost 64%. And then 10%, almost 11% did say I would use it, but don't have a smartphone. So that's an interesting insight that almost 11% of the respondents did not have smartphones. Which of the following are the most commonly visited destinations when transportation is available to you? Grocery shopping, medical, dental, general shopping, social recreation activities.
Social has been number 4 across the board for the last 5 years.
Yeah, that has not changed even through COVID, interestingly. Work interviews and job training next.
That used to be in the 11, well, 5 years ago, it wasn't even, it was in the top 20. Last year was like number 11. So that's very interesting seeing that is moving up into the top 5.
Yeah, that is really interesting. Weekly medical appointments, pharmacy, faith-based organizations. And then down here, we've got counseling or treatment, rehab, and school/college. What cities do you travel to the most for the following? These we'll be able to send out a good breakdown of them. It would take a long time to kind of go through them as it is right now, but it had people give open-ended responses to each of these for where they go for these categories. Which of the following do you use most often to get transportation information that you need? So smartphone apps and text for information had 42%, phone call to transportation providers for information at 31%, and then the next was transportation provider websites at 21%. Down below, all under 15%. I asked a friend or family member, public agencies, refer to the printed Lorain County Transportation Guide, phone call 211, and faith-based organization. Next, are you familiar with the Lorain County Mobility Management Program, which helps residents find transportation options to get from place to place? Hopefully they say yes after taking this survey, but in this, yes was only 14% and then no was 86%. So more work to be done just to get the information out there so people know about how to find the resources they need. Where do you currently live? You can see majority Lorain and Elyria, as you'd about expect, with a good representation of the county, and then some of the smaller cities down here, but pretty well represented across the board for most places, at least according to population size and county size. How old are you? You can see the breakdown of this. Very few under 18. 18 to 24 was 2%, 25 to 34, 10%, 35 to 44, 12%. And then it really, you can see it best from here. Majority did end up being towards the older end of the spectrum here, but all in all, fairly representative. Primary language spoken in the household, English, of course, being the number 1. Spanish had a few respondents. Do you have a disability which requires you to use a cane, walker, wheelchair, and or other device? 26% said yes. So that's a pretty high amount, I think, for this representation. That was quite a few people who did have that. Which also speaks to the answers before where people were asked if they would use transportation options, and an option for no was no, they're not accessible to me. So I think it shows that the options that we do have are pretty accessible because a fair amount of people said that they need a mobility item, but very few people answered negatively about that. Do you consider yourself a person of low income? 54% yes, 36% no. This is a little breakdown of how they self-describe, and it was a pick 1. So employed outside the house, work from home, homemaker, retired, student, unemployed, on SSI disability, and other. You can see employed outside the home, retired, and on SSI disability were the 3 highest. And then this next one is just giving their name for more contact. So that is a very, very quick and brief overview of all the data.
Thanks, Matt.
No problem.
Any comments on the data?
I saw you identify where they live, and maybe I missed it. You also identify where the people that are working, where they're actually working?
Yes, the one question that asks where do you go for the following, there's a work option, and they're all open-ended responses, so it was a little.
So where, I assume the majority of the people are working in Elyria, Lorraine,
I need to look through the data to see. Sharon, do you know off the top of your head?
because I mean, if we know the majority of the respondents are in Elyria and Lorraine, I assume that's where they're living, is where they're saying they're responding.
Yeah, most of them are responding to Lorraine and Lorraine.
Right, so the next question I would have is where are those people living so that we can identify on getting those people that want to work to the places they're working primarily. So that's why I was asking, do you have that where they are working?
Not available yet, but we will send that out with
Because
the information.
that would tell us where we need to put the transportation the most, I think.
Well, we did run a pilot because we were finding, we did run a pilot with Togus and Avient over in Avon Lake. And we were, taking people from Lorraine and Elyria over to those places because we were even finding from Avient, and I was surprised when we did look at their anonymous list of where people were living. A lot of people were already living in Lorraine and Elyria, and we were trying to create transportation for even people who had cars.
Yeah,
The opportunity to use this transportation service to go over there. So that is what we are finding, that, you know, people specifically Lorraine and Elyria, but we've been hearing a lot even from Oberlin that they need to get up north. And we just don't really have that connection to get all the way to Avon Lake.
I've heard, wasn't there a transportation route that was shut down a couple of years ago from Oberlin?
No, they have an on-demand service that's through Lorraine County Transit. But they do it for work, but they only go up to like Route 254.
Okay.
For their on-demand service, but it is for work and it operates from 6 a.m. to 6 p.m. and then 9 to 12 to get that late shift. Mhm.
I do have a question with the Spanish being so low. Does that mean that demographic didn't really get put into this survey?
We did create some of the surveys in Spanish. I will say that we probably didn't do a good job with reaching out as we should have. So that's something that we need to look at because we do the survey generally every year so that we can just understand what's happening. So it's a segment of the population we need to do a little bit better at reaching out to. Right now, we're trying to even get the transportation guides converted into Spanish so we can hand those out. All right. And yeah, I mean, if you have any other questions, you could talk with Matt and he could get some more data for you, too.
Sharon?
Yes?
Hey, good morning, everyone. This is Tiffany over at Lorraine County Transit, and I just wanted to make a comment in regards to the feedback for picking up individuals on time. And that is a multi-prong approach. So some of the issues that we run into as far as our fixed route being on time is the number of pickups and drop-offs, you know, how long it takes for somebody to get on or how many individuals are flagging the driver down to stop as far as getting off the bus. So we can't factor that in. I field phone calls all day long, you know, where the bus is 5 minutes late, where is it? And those are variables I can never anticipate or control. And we've also run into issues on more than one occasion with making sure that we have our passengers for dial-a-ride that are in motorized wheelchairs, that those are anchored and secured properly before we move to the next destination. Again, not something that we can factor time in on. And if an individual is scheduled for a pickup and they don't come out on time, you know, the drivers are very courteous and they will, you know, extend that wait time on a regular basis, as far as, you know, we'll give them an extra 5 minutes or whatever, but all of that is a chain effect as the day goes on. So I know it's frustrating for the individuals that utilize our services, but we try to accommodate everyone all of the time. So it's, you know, there has to be a little bit of flexibility and understanding for the people that use our services as well.
Yes, and maybe what needs to happen is that we need to, or I can, as mobility manager, be able to manage the expectations. That's what, you know, because we can't change that portion of it, but what we can do is educate, because that was one of the 5 goals on educating people, because I think, as you can see, people don't want to share a ride. That's not gonna happen if we want to be efficient and effective in our transportation service. But they're expecting to have an Uber-like service, and that's
They
just
are,
not
and
gonna
it's an
happen.
unrealistic expectation, unfortunately.
So I think that, that is something just to think about as we're going through the threats as to how we can address that. So, any other comments? Okay, am I back?
You should be back in there.
Okay, a minute, here we go. Oops. Why is this not moving? Oh, let's see. Oh,
Okay.
sorry, 1 minute. Oh, is it because I'm not?
I don't know, it looked like it was moving on Zoom, but not in person.
Huh.
Oh, part of the that's the beginning.
Sorry about this. We should have where Lauren is. Okay. All right, we're gonna move on. Lauren. She's moving all around the place. Lauren Kay, she can say her last name again for you. Is gonna go over our strengths, weaknesses, and opportunities that were discussed at the last meeting. So Lauren, I will advance it
All right.
to the next slide.
So
There you
yeah,
go.
just wanted to kind of recap, last time we had broken into small groups and shared out on our strengths, weaknesses and opportunities for transportation in Lorraine County. But I kind of wanted to do a quick recap, and by all means, folks, share if there's anything we missed. But in terms of our strengths, one of a big theme we saw was infrastructure and collaboration. So we have an infrastructure. We have a lot of providers that are willing to work together, that are networking with one another. We have several communities in Lorraine County individually that are exploring alternative transportation, bike routes, adding those types of things. We have community-based programs aimed at car ownership, like the Buy Car program, that they do at Community Action. Some program dollars and emergency assistance funds out there also look at car repairs, when it is important for the individual to be able to get to work or be able to get someplace important, when you do a car repair. We have generally a strong community buy-in, as far as from our government leaders, our nonprofit leaders, our residents. We have the community knows we have an issue and knows we need to solve it. So we have that momentum, we have that ready to go. We really need to take advantage of that. And then another thing that we even saw today in this meeting, listening to some of the interviews, LCT has experience with more routes because they've done more routes in the past and we know it was successful. And we also know that LCT gets very high customer service marks from their riders. And I can speak from experience, the drivers are very, very lovely. When I rode the bus, they were great. And I've gotten to know some of the drivers because my new office location is right next door to them. They're really good people over there. So those were some of the strengths. Can anybody think of anything else that maybe we didn't reflect up here that we talked about last time? I would say the fare structure. Oh, so that's another one. Yeah.
Yeah.
Me as a strength. Fair
As a strength, because
Yeah.
we do have a process for certain folks being free,
Okay.
certain folks being half price, and it's as a place to start.
Okay. Great.
All right. Whoops. Why is this not? There we go.
Weakness. Okay. So a lack of service capacity. So again, we have the bones. I'm gonna steal a phrase from one of my colleagues. We have the bones, but we need the meat to put on the bones. So we have the providers. We have a lot of providers here that want to help. We have a lot of buses that are sitting. We have, a lot of, assisted living and independent living facilities. They have buses, that they transport, but they don't run all the time. So we have some opportunities there. We have very little to no service in rural areas. South of Overland, there is no fixed route or anything like that. We don't have a one-stop location for transportation information. We're working on it, but if everybody knew transportation in Lorraine County, da-da-da, blank, United Way, or whoever it is. You know, we need to have one central location for people to get accurate, consistent, good information. And then we do have technology barriers. Obviously, you know, we have a mixed population in Lorraine County, and some are gonna be very welcoming to technology, others are not. So we do have to be aware of those. User experience with, transit is, bus route signage. There's a lot of old signage out there. Some of the buses are not labeled or don't have numbers. The numbers are not easily visible. And then the transit system could be a little intimidating to use. If you've never used it before, get online and find the information. Sometimes that can be challenging. There's a lot of information out there. It's kind of hard to tell which is good and which is old. You know, cash only, you have to use exact change, you know, the stops are not always announced. So there's a lot of challenges to actually and that experience. And then the infrastructure, bus routes need evaluated to see, are the routes really going to the place they need to be going to, or are we missing the mark there? And then, you know, we've had a lot of leadership turnover in the community, and sometimes it's really hard to get momentum when you have that kind of turnover to be able to get this going. Anybody else have any weaknesses to add?
One of the things that's, I think is missing is you don't have the funding to implement what you need.
Yes, yes. I put that in service capacity because you're right. We have the bone, we don't have the meat. I mean, the meat is money. I'll come out and say it's meat is money. Absolutely.
All right.
Is there a study been done to say what the amount of money you need to put this together?
Back in 2018, there is an organization called Move Lorraine County. Alexis sits on that. And they are an advocacy organization. It was before Alexis was on it. We like to compare ourselves geographically to Lake County. Lake County has a wonderful transit system. And at that time, they were spending $13 million. But they have a dedicated sales tax, and they were able to get their community to vote for it. That's where the challenge comes in for Lorraine County. We have been struggling with getting people to vote for it, so that's the reason why we don't have it, because we don't have a dedicated sales tax, and that's the reason why we had to go from 16 routes down to 4, which are really 2 routes back to back. And because we can't get anything passed in Lorraine County.
Is it getting it passed or is it getting it on the ballot?
Getting it passed, no, it's been on the ballot. It's been on the ballot about a half a dozen times. It has not been a sole issue on the ballot, though. It's always been mixed with something.
I never saw anything on the ballot that said transportation. It was a mixture of things.
Is there a way to get on the ballot as just transportation?
It is now. There's been a change in the how you see. Back then, you had to have a 0.25% sales tax. That was the lowest amount it had to be, and that's where some of the discussions were, where elected officials and others didn't see eye to eye because they thought that was too much money for just one. Now, I think in 2017. They changed it, so now it's 0.1% can be dedicated for something like this. And so if we would have had that in 2016, we could have done a 0.25% a 0.25% sales tax dedicated to transit, and we might have been able to get it passed because it was a lower
Karen?
amount. Yes.
Do we know what the income ratio is from Lake County compared to Lorraine County? In regards to that dedicated sales tax?
We do not. I mean, I don't know off the top of my head, but I remember I thought we looked at all of that, but maybe we just looked at the geographic area because it was urban and rural. And about the same size. It's a little bit smaller of a, population wise, a little bit smaller, but I don't know if we looked at the income level.
Okay.
And I can speak to that too. So in the aging network, our counterpart within our aging network is also Lake County. So we do a lot of kind of comparison. Geographically, again, income wise, I can state that pretty clearly that Lake County has a higher, their per capita is quite a bit higher. But, you know, comparing geography, size, those types of things, we are a good comparison.
Okay.
That's one more question.
Yes.
So if we got something on the ballot, what percentage will we ask for to meet our financial needs? We know that.
That is something that we would have to have a discussion with the elected officials that are in charge of Lawrence County Transit to determine what they would feel comfortable with, because
But no, from our perspective, what do you need?
well, it depends on where we want to service. Do we want to service the entire county?
If it meets the needs of the surveyors.
That, like I said, in 2018, in 2000, way back when, 2018 or before, 2017, it was 13 million at that time, but we all know that costs have gone up. So I can't even come close. It would be over 13 million we would need. So, all right, so you want to go on to, this is our last opportunity before we're going to do threats today.
Opportunities, so opportunities kind of, I can see a feed from strengths, so buy-in from the community leader. We have a strength and an opportunity in this community because we do have the community interested, the community is getting invested, and certainly the community leaders are getting invested, as we can see from this one right here. Our grassroots efforts, so, you know, Sheriff briefly mentioned Boom, you know, that kind of started in what middle, late teens. And we're gaining momentum, you know, the momentum is here. I mean, I've lived in Lorraine County my entire life. And I can say that I haven't seen this kind of momentum around one issue in maybe ever, but it's certainly quite a long time. So the opportunities, you know, looking at microtransit systems in Lorraine County, which I believe we're gonna get a little bit of a taste of later. Get systems working together. So our systems are starting to work together. Government, hospitals, employers, the education institutions, we need to get them all in the room. Government, you know, for the funding piece, hospitals, you know, the hospitals. We get calls, the Office on Aging all the time from getting people to and from doctor's appointments and hospital appointments and things like that. You're working with the hospitals, can we make this work? Employers, as Sharon mentioned, you know, doing the workforce pilots and educational institutions like LCC, schools, colleges, things like that. Accessibility, moving toward maybe you know, purchasing online bus tickets, you know, scheduling your ride online, having online routes and schedules. Bus signage, you know, having the drivers announce the stops. And as we're doing now, engaging the community and solving the problem. Any other opportunities that I have?
I have a question on securing enough drivers, could that be a problem? I mean, if you're gonna expand and, you know, you look around, a lot of buses, school buses,
Yeah, well, and that's.
you know, and the pay, you know.
Yeah.
That is a problem. I go to a couple of transportation conferences, and there's a constant seminar on hiring drivers. And retaining, and I know those organizations that have had to hire drivers, you know, Wesleyan Village, Office on Aging, Kendall, they've all struggled.
I haven't had 2 drivers yet.
It is a struggle because of the type of individuals that they're servicing. Number one,
Yeah.
they feel insecure about their abilities to service like the elderly population such as ours. And the training, you know, we can only offer so much training.
Well, and many of us are nonprofits and we just are not that competitive with our pay either way.
Right, definitely.
And funding, goes back to funding.
So think of that's a threat that you may want to be thinking about as well as we go through that. Anything else regarding opportunities?
Does anyone know if the county spends money from the general fund to operate it?
Yes, that's exactly how it's paid for now.
And do you have any idea how much?
Tiffany, you're on the line. Isn't it 1.5 million that's being spent right now?
I would have to look. Don't quote me off the top of my head. I'm coming off of a rough night of the storms and my brain is mush. I can look into that and get back to you. I honestly don't want to give you a bad figure, and I truly don't know off the top of my head.
I want to say it's 1 or 1.5 million that's being spent right now.
I'm just wondering because.
But you can get back to it. Tiffany works at
It's one of those things where if you do this, maybe you roll LCP into it somehow so that you have that money that the commissioners are already spending. on a transportation system?
Well, they are utilizing some things in order to, make the most of their service. I know that they provide Medicaid transportation, so they're able to tap into that because they do have funding that requires a 50% match. And when they can get that other 50% from elsewhere, whether it be private organizations or other service, organizations like Medicaid or even veteran services, they're able to use that to match, to pull down money. So, so that is being looked at. It's one of these things where I think government entities, nonprofit organizations, and the commissioners all need to have a conversation about what the needs are to determine how do we make this work together. Yes.
Is there in terms of buy-in, or kind of piggybacking off of that, is there an opportunity potentially to have local communities, like instead of subsidizing solely through a tax issue on the ballot, to have communities that want it to buy in also, to like invest, whether it's, percentage or doing their own local things or securing grants, like kind of a combined effort versus one fell swoop on the ballot?
I believe that there are opportunities to create what's called transit districts. So that if like Lorraine and Elyria want to just go in and work together, that's an opportunity. And so that would be something that maybe the city managers and mayors association could have a discussion about. Because that's the tough part, is that there is a certain population that is not gonna vote for it because they're saying we're never gonna see it, so why should we support it? And that probably is the truth. I mean, I can't say that, hey, if you pay for this, you're gonna see it.
I think part
Yes,
of the
Stephanie?
problem with the failure of the sales tax dedicated to transit over the years has been there was never an outlined plan. The money is going to go to the following aspects of transit. It was just presented as it's going to transit. It didn't outline how it's going to expand it, what services it's going to make new. It just was never outlined properly.
Yeah,
It's
that is
hard
all.
as a taxpayer. I'm not going to vote for something if I don't understand how the money is going to be dispersed.
Well, you might have an opportunity because the commissioners are hiring a company called Future IQ, I believe. And they're starting conversations about developing a strategic plan on how to best serve the county. So I've been invited to a meeting the first week of September to talk about veteran issues going forward. And to piggyback on what Peter said, I think you need to have a route and a plan to go. I have always found that taxpayers, believe it or not, don't mind paying taxes so long as they feel it's going to a good cause. If they can't understand what she said, then the answer is absolutely not.
Right.
So yeah, now you have potential now because they're trying to develop a strategic plan going forward. And this can be part of that transportation in the county. And not to throw my good friend Joe Miller under the bus, but is there anything that you have heard on the state level that the state might, and not that I would expect you to know right now, but about state funding that could help kick in money? Like matching?
Well, it's a lot to unpack because you're looking at, low income and senior supports, and then you're also looking at economic development, which is a big thing that really is their focus. I hate to say that, their focus is, we want to get people to work. If we happen to pick up some seniors and low income who don't have vehicles, hey, great. And that really is, a dark answer.
Yeah.
But what I think whoever in the county is, has the idea, sorry, I'll stand up, has the idea of this, we're gonna start with, where is the demand for job? Where do we have our highest working populations going to? So if you have out there in Colorado, you have a big it becomes a big industrial center where there's lots of people working under a roof, or whether it be manufacturing, whatever. We need to be a part of that route. So I think it's going to take a county-wide approach, asking for drawdown from the state. I think that's really what's gonna drive it. The only time you're gonna have the state come in is when Jobs Ohio and the governor or the economic development division under the governor, Department of Development, come together and say, hey, we're putting in an Intel in New Albany. We need to get people from Newark, and we need to get people from downtown Columbus to that $1 billion investment site. So they have transportation. So they're working in plans for transportation routes in the infrastructure build out. But that's when you drop $1 billion investment in the middle of Ohio. We don't have that. So we have to have a local plan that says, this is what we have, this is what we're building out. This is our kind of our economic view, and then this is our transportation view. And somewhere along the line, it got to feed into the needs of the elderly and the low income who don't have that transit system. Unfortunately, I believe where we're focused at here in the United Way and transportation views is not where the state's at. They're at mentally economic development. We're at the most needed, those who are in the most need.
And the reason for that is primarily because,
Yeah.
the funding that that funds my position, the focus is specialized transportation 5310, which is a focus on seniors, people with disabilities, low income. Now, workforce also is a part of that because it was folded into the 5310 program back in 2016. So we do kind of work on that, but our main focus are those most at need.
I want to thanks Rep. Miller. You have a way of explaining things that maybe it has to do with your previous.
Most of my post-undergrad, yeah, I'm trying to explain stuff.
He has a way of explaining things. But I think what I took from what the representative said was we need to sell it as not primarily for, like, I don't want to say we don't care, but we're not here. The primary purpose of transportation is not to help old retired people, it's to help people get to work. That's what's going to get the state's attention. So that fourth item that you showed, where you said we used to be in the top 20, now it's 4 people looking for work. Combine that with the question I asked earlier and saying, okay, we know where they're living, Elyria and Lorraine, where are they working? And then sell that to this. That's what I took from him. So if you're actually having a thought group, think about how you're going to sell it as an economic development thing. We're not as interested in transporting retired or disabled, but at the end of the day, we can work that in. I think that's what we get.
And I think the feeders, I think what we do is at the local level, we're like, oh, okay, now we need to feed into that economic loop of moving workers. And guess what? As we head over to Ford or wherever, Ford obviously not a good example, let's try a different one, but as we head over to another location where there's a high need for low income wages, jobs that they're usually paying low income wages is the reason why they're not able to have their own car. We can stop at the hospital, we can stop at the VA, we can stop at the different locations that are needed. And the youth, I mean, they knew they could jump on a bus and get to the community college and take their classes. They would do their homework on their phones or on their laptop. They would love that.
Yeah.
They don't want to drive, except for my boys, because, they cost money and I think they just wanted me to spend it.
Part of that percentage that said absolutely never will use it.
We are very.
They're part of that percentage that said they would absolutely never will use it.
Yeah, they would use it. They've been eating here. They see the advantages in public transportation. So.
We're very fortunate to have you. Thank you.
Yeah,
Thank you. I appreciate it.
Yeah, in looking at the survey data, though, it's like even the categories age unspecific, the top needs are medical, dental, grocery, right? So like, I think we kind of collectively understand that if those needs are being met, right, and people don't have to spend their time and energy and resources to devote finding transportation to those, they're gonna have time to go, to devote that to traveling for work, applying for jobs, going to college for training.
Well, as you're all saying, we could really do both. If we need all of this, right? But if we sell it to the elected officials that it's economic development, because those times necessarily that people are going to work are not, in between those times, there's a lot of time, right? To be able to go to medical and to grocery shopping. So that, we sell it one way, but we know that
It's
our focus is to solve the real need.
Both are
Through,
the real,
huh?
you can't, getting people to work is a real need. So when you say, you gotta say both things, if you're standing up in front of people, people are going to know when you're not being true, I guess. So if you're standing up and selling it, you have to believe in your heart of hearts that getting people to work is the real need.
And you know what, I misspoke when I said that, because the American Public Transportation Association says every dollar invested in public transportation generates $4 in economic activity. I say that all the time. You're absolutely right. I sit on the Lorraine County Chamber Board. I know that. However, 26% of our population are seniors. We have a large group of people living in the southern part of the county. We have a lot of people not getting to medical. Their quality of life is horrible. All of these things, like you said, are real needs. So please do not mistake, what I have said to say that one thing is better necessarily than the other.
I apologize.
Just to recap what you said, what he's saying though, is when we're selling this to the people we need to sell it to, we have to focus on economic development.
Yes.
Then as we develop a plan, you rope in the things you need to address for the senior.
And that's what I was trying to say.
You have to consider your audience. Well, of course, when you're looking at county, yes, the first thing that any elected official, we have to have a successful economy. Of course, yeah.
And also, so do we need to add to weaknesses that we don't really have a structured plan yet? And so we need, because when you're selling it, you have to sell that you have a plan and you actually know how much money or funding it's going to take, so that they know that you have really, your data and you know what you need and you're representing the public. So maybe that's a weakness, that we don't have a structured plan or know the funding that we needed.
And that would be a great opportunity for Move Lorraine County to also look at and help form.
We can do that. We can help you do that.
So let's move on. We're running out of time here.
Can I answer your question?
Yes.
You had asked what the commissioner's contribution is for our budget. It's 300,000.
That's it.
Well, that's their contribution though. They're using that money to leverage other funding.
We utilize federal, state, and local match from other agencies, but the commissioners out of the general fund give us 300,000.
I mean, that's a problem. And probably should be recognized as such. I can tell you that my organization had an agreement with LCT. I believe we still do. And they transport veterans and we're supposed to pay them. I've asked for a bill. I haven't got a bill from them in 3 years. So when you say that there's holes, that's what we need to consider. I can tell you when I started on my job, we were paying life care over $20,000 a month to transport veterans. I did the math. It was $4 a mile. My guys, I can make government more efficient by hiring more government employees to transport veterans. I can do it for less than $1.25 an hour. Now, those numbers are about a year, 18 months old, but it's probably a little bit higher on both ends. So making government efficient is fine. If a good system developed, right, I'm still paying about $4,500 a month for life care, so I've reduced it by quite a bit. But if there was a very good system, right, when my drivers couldn't do it, we could go to a system and start paying that reliable system to do that instead. So that's money that's going to life care. Let's say $5,000 a month, that's a little high, but still that's like $60,000 a year that could be going to an outside system. that can help. So I think we need to look, if you're gonna do it, I think we need to look at all the people that are paying, all the community homes or what have you.
So what I wanted to do here right now is show you this video because we talk about a lot of the problems, but I wanted to provide some hope for what can happen, because I know at one of our meetings before somebody said, can we bring somebody in to tell us about how they're doing in another community? So there are two videos, actually. This is one, it's a program called VIA, and it's an on-demand service. And I just would love for you to hear what they're doing and get your input on this.
Now, to offer local perspectives, we have the City of Wilson's Chief Planning and Development Officer, Roger Lentz. Roger, welcome.
Thank you. Good morning, everybody. There it is. All right, so I want to talk to you about how we've applied some of this in Wilson, North Carolina. Eastern North Carolina, very small North Carolina city in our eastern coastal plain, if you're not familiar with it. Today I'd like to talk about three things. RIDE, a new transit system that we've employed. I want to talk to you about how we've gotten greenways and paths going for that active transportation, and how we're really focusing on taking old roadways that really were not done in a contextual way and redo them. So let me talk about RIDE. So we have a long history of transit service in Wilson, fixed route system that covered just about 40% of the city, and was really designed in a time when downtown was a center of commerce, right? You had the old tobacco warehouse jobs that people got to. You had agricultural, different jobs there that don't exist anymore. Those are in corporate parks where we have pharmaceutical companies and all that on the edge of town. So we had to rethink about how do we do transit? Our buses only ran once an hour. So I want you to take a second and imagine yourself in this situation. You're transit dependent, low income. You're at your job. Maybe you're working as a waitress or waiter or some other service job that's low pay. You have a child in the daycare. You get the call that they're sick. Okay, how do I get that child? Right? If you're transit dependent, you look at your watch, it's gonna be 45 minutes for the next bus, so you gotta wait. Get on that bus, and in Wilson, where I can get anywhere in my car in 15 minutes, I'm gonna have to make a transfer at the downtown station, get another line. 40 minutes later, I've arrived at the daycare, so now I'm over an hour and a half in, right? Get the child, I know that you gotta get him to the doctor. Maybe I can walk to the doctor, but there's not a sidewalk. So I've gotta get down there, do that journey. Then I gotta wait for the next bus when that appointment's done to get home. Maybe I have to stop at the pharmacy. All said and done, that's probably a 3 or 4 hour issue of your day. You don't have sick leave or leave time, you have not gotten paid. Can we do better for that individual? And I think that's where RIDE comes in. So RIDE is the mobility as a service that was just discussed, where you can use an app, and understanding that not everybody can afford this, a phone number you can call, unlike Uber or Lyft, where if you don't have a smartphone, you're locked out of that service. And we were able to cover not 40% of the city, but 100% of the city with transit service. And we're able to do that with a 15-minute average wait time. So you need that trip, you go on the phone, or you call the call center, you get that trip in 15 minutes, you're taken to the door of the daycare, do what you need there, you get home, and that journey that issue that took 4 hours of your day is now an hour and a half, which is a lot of time for that person that has to deal with that situation that's transit dependent. And I think that's really critically important. And the fact that we were able then to take the same resources that we had for fixed route and cover an entire city, now I'm connecting people to jobs that were out of reach for them because they couldn't afford a car, maybe they couldn't drive. So we've been doing this for nearly a year and a half. We're over 150,000 trips. Last week we did 3,500 trips. The fixed route before that was 1,450 trips. And during the pandemic, when we had to take the fixed routes down, we were only doing 300 trips. So even during a pandemic, our transit ridership went up 140% over fixed route. So it's been a real game changer in Wilson, and we're very proud of it. We've gotten recognition from FTA. We've been able to get grants to extend our hours. And we were able to use it to provide vaccine trips to folks when we did that for free with the help of our partners at NCDOT. But what's most proud about it is the change that has been made in people's lives. And this during COVID, right? So that individual I'm telling you, and our average rider makes less than $25,000 a year. We've changed their economics. In that situation, that person, that parent, might have had to get a taxi cab, make multiple trips, and spend $40 or half their income that day. On ride, they could do that for less than 10 on those multiple legs. That's a big deal. The other thing that we've been able to do is connect people to work. So these pharmaceutical jobs that were out of reach for people, the number one thing they said that was a problem was transportation. People did not have a reliable way to get to work. We've changed that. 48% of our folks said this service has enabled them to get a job or keep a job where transportation was a barrier. And I think that's really important. I won't read all the statistics, but I think it's worth noting that talking to your customers to find out how the service is going, how the service can be improved is critically important. And in our COVID world, I don't think we'll ever go back to fixed route, right? This has proven to be exceptionally great service, exceptionally well received. And I'm not sure of a transit company or transit system in the country that's had 140% growth over what was pre-pandemic. So we're very, very proud of what we've done in Wilson. Well, I think the bones of our city are set up for that 15-minute model, but obviously a lot of disinvestment in some of the central areas, not unlike a lot of smaller towns and cities in North Carolina that are kind of outside the metro, especially in eastern North Carolina. I think that I too think, fixed route and, what Charlotte's done. We used to work in the Charlotte area, what Charlotte's done with light rail, and that's exactly what they need to be doing. But there's still even transit deserts in that model where I think microtransit can fill in. And, now, let's be honest, we're doing this like transit, so the city's putting in a lot of money, DOT's putting in a lot of money. $1.50 fare is not recovering the cost, but, when you start thinking about a city that's, 25% poverty rate, transportation as a barrier, the cities aren't in the social service business in North Carolina. That's a county function. I think this is a perfect way for the city to do its role in connecting people to economic opportunity. And, while I think the county van systems are a lifeline and they're very important, but, if you just had to go get a gallon of milk, right? I need a gallon of milk. We're all gonna go out and get milk and bread after this because the snow's coming, right? Imagine, I didn't call a day ahead to make that reservation on the county van system. So you got to plan so far ahead that you just can't make that work. And so I think that's what microtransit's done in Wilson, is let people be spontaneous and get the things that they need. And one of the quotes, I didn't read verbatim, but if you caught it on the slide, was, we have some blind population that basically said, "It changed my life to be able to essentially compete with someone that had access to a private car." And I think that's really important.
So I wanted to share that with you to show you that there is hope, there's opportunity out there. We've been talking a lot of challenges that we're having, but this is something that is happening in the United States. And VIA has been a very big, popular service that a lot of organizations have using. If we have time, I will show you what they're doing in Toledo as well, but we're hoping to get to the threats today. But before we get there, I wanted to also mention, before we start talking about the threats, that something that's happening down south, which is the fact that the Lorain County Fairgrounds is planning an expo center that's going to be 55,000 square feet and will hold 2,000 to 3,000 people. But guess what? We don't have transportation that goes down there. So that's very interesting. I'm very excited the fact that something is happening in the southern part of the county. But there's,
Currently it's full.
Currently is.
yeah, currently it's full. Yeah, go ahead.
I don't mean to interject here, but so when I first got into this about 5 years ago,
we had, Ohio State came in, we actually came in together, and a lot of us freshmen, were discussing transportation, smart vehicles and a lot of things. And one of the things that they said was the idea in Ohio that we're gonna start expanding our busing system, it's not gonna happen. What we're probably gonna see is, maybe the 3 Cs getting a high-speed rail. Amtrak wants to run an east-west, a couple east-west routes, and then everything else is gonna be multimodal. It's going to be what this ride is. I mean, this is a great example of what they're envisioning for filling the need for work. And, you know, that a lot of those down in Columbus are what's the saying, idle hands or the devil's workshop or something to that effect. If I remember that correctly. And the idea is that cities will be better off if they can get their populations to work. Because when they're at work, they're not in the city idly trying to do things. And that means younger kids, you're 18 to 25. Well, I don't have a vehicle. I can't get to work. And then it just snowballs. But I think that one of the things we need to think about is this idea of tying in business. Hey, if we bring one of your employees to your business, will you cover some of that cost? And what you end up seeing is businesses will make agreements with what's it called, a ride, they use that in Lorraine County. And then the veterans are like, hey, the veteran commission says, we need some more veterans picked up. We have funding that we can contribute that. Hey, we've got some Medicaid patients that are recipients that need to get to medical care, dental care, right? Then that's picked up. And yes, but with technology and the ability to have the app and the information at hand, this multimodal transportation system that's set up in Lorraine County could automatically be just filling out. You know who your rider is. Like, I don't know about you, but I use Lyft or Uber. Use Lyft, it seems like lately more. And they're like, hey, here's a picture of me and here's my information. And all you have to put in there is, here's my business code or whatever the code that the business hands out to you or the Medicaid hands out. And that way you put that in the phone and that app will just bill each one of those organizations. And then it cuts down on the county's contribution. Now they're just picking up for areas where we don't get reimbursed by the feds or the state. So just a thought, this is more likely going to happen before you get a bus route that's going to go from the fairgrounds in Wellington all the way to the lake on Route 58. My mind was the old transit system when I first started thinking about this as a councilman in Amherst. And now the technology has jumped so far. I'm like, wow. My idea at that time of how to get this transit back up and running was so outdated. So I've had to put it in high gear. Thank you for the few minutes, but I wanted you to know that the state of Ohio sees this as a worthy funding model and support than they would adding bus lines and routes and fixed. And that does. What was the 2 things they wanted? They wanted more destinations and more timely way to get there. That ride system is a multimodal system that the Ohio State presented to us. And I think that you're going to see acceptance of that and maybe even financial support.
Yeah. So I'm wondering if you want to see what they're doing in Toledo. Briefly. Would you like to see? Sure. Okay, they're using here. I'll go straight to this video. Tarta Flex. They're using VIA. I just wanted to bring it home that this is not something that's just happening in North Carolina. This is something that's happening closer to us. And then we can try to end with the
TARTA has rolled out its new program to help underserved areas. The Flex program will provide affordable rides to connect suburban and rural areas with city service. 13 ABC's Willie Danley joins us live with more on this story tonight. Willie.
Diane, when Uber and Lyft first came out, it changed the way that people got around. Now TARTA is using that same business model to change the way people are using public transportation.
TARTA Flex is our solution to bring public transit to all of Lucas County.
This year, the Toledo Area Regional Transit Authority rolled out its new TARTA Flex program, an on-demand micro-transit service that reaches the majority of Lucas County. Sam Meldon, the Chief Communications and External Affairs Officer, tells me it doesn't make sense for the huge TARTA buses to drive down country roads, but the rural areas still need to be served.
So TARTA Flex is really that first mile, last mile solution, so that if you want to tap into the fixed route service and go all throughout the city of Toledo and Lucas County and Rossford, then you can. But if you just want to stay within that area, a Waterville, a Maumee, a Sylvania, stay within that zone for a shorter trip, then TARTA Flex is the perfect solution.
TARTA Flex covers 3 zones outside the city of Toledo. The Northwest Zone, which encompasses Sylvania and Holland, the Southwest Zone, encompassing Monclova and Waterville, and the Rossford Zone. Waterville Mayor Tim Pedro says the program is a game changer in terms of local transportation.
It's on the principle of Uber or Lyft, but much more economical. And you're right, seniors can use it for medical appointments.
The rides cost $3 per person per ride. And from June to August, people 19 years old and younger will be able to use the Youth Summer Blast Pass to ride any TARTA transit, including Flex, for free.
TARTA Flex really is the most affordable ride share, point-to-point ride share in all of Lucas County. There's no doubt about that.
Pedro tells me the program will do more than just help people get where they need to go. It will also help the planet.
Across America, we need to conserve energy, roads, and so forth. And I think this is just an opportunity to take advantage of another tool in our toolbox.
If you want to order a TARTA Flex just like this one, it's as easy as the snap of a finger. All you have to do is download the app, call the customer service number, or order it online. And paying for it is just as easy. You can pay in cash or Easy Pay. Reporting live in Toledo, Willie Danley, 13 ABC, Action News.
So just wanted to share that with you, get your thoughts on that.
Lucas County is good because they have I always thought that Lucas County and Lorain County, first of all, veteran population we consider that a pure county for us to look at. You also have Toledo, so you have an urban center. And then when you start going south into Lucas County, you get a lot more rural. So it might be worthy of reaching out to Lucas County and saying, tell me about this TARTA Flex. How's it funded? Who's paying for it? Because unless I miss it, I didn't really see how it's being funded all that much.
Well, I believe that they're part of a group, which Lorain County is part of it too, called NeoRide. And so we are able to contract, or counties that are part of the NeoRide, which is the Council of Governments, are able to contract with services like VIA at a reduced cost, because it's a group of transit organizations that are part of this. I know that the county is aware of this. They're looking at options like this. But I just wanted to present to you that, these two that we've seen from North Carolina and TARTA are seemingly hitting everything that we've been talking about. They talked about jobs, they talked about seniors, they talked about the app, but also being able to call. So it's not just about the app, talking about paying on their phones, because we've been talking a lot of gloom and doom and figuring out, what do we do? This is what we can do. It's already out there, and it's in Ohio already too. So just wanted to present that it's not all gloom and doom. We have examples and they're close by.
I think that first mile, last mile is the key. I mean, that's really what the focus will be. You can get a transit busing system to take you from point A to point B down the major strip of, say, Broadway or Middle Street in the area, wherever, but it's that last mile. And I think the mayor was saying you need to start configuring your infrastructure in each of your municipalities of pedestrians, so they can get off and walk that last quarter mile if they need to, or so you need more pedestrian friendly sidewalks. And so there's tons of scooters and bikes and things that they'll get there and then they'll just take a scooter around town. We saw that a lot. I went to a conference and you flew in or you drove in, you parked in the parking garage, but you want to get around town. And the amount of people that would just get on those bikes that you get on, put it in there, swipe it and go. A lot of younger youth will use that because they immediately go. They're like, I'm not waiting for 15 minutes for a lift. I get on the scooter and I'd kill myself, but they would get there where they needed to be. It's that last first mile, last mile problem, getting them from their home to the bus stop, getting them from the bus stop to where they need to be. And that's the challenge of, getting all these different leaders in the different local communities to buy into helping with that, first mile, last mile issue.
So let's maybe just do this threats together. I was gonna have you guys break out into smaller groups. But maybe we can just kind of go through this real quick and then be able to try to end on time. So threats, we've heard the strengths, the weaknesses, the opportunities. We didn't get to threats last time. So threats are based on everything we've heard today. You know, think about all of that, but threats are areas with potential to cause problems. So would love to hear your thoughts on this first. What changes in community are cause for concern? Yes, Alexis.
It's the fact that, like we said before, because there's no jobs, you have a lot of younger people leaving the county. So it's like an exodus of our younger people, or?
Well, I want to hear from you. What do you think are causes for concern? Because the reason why I'm asking these questions is because we're trying to get to what are some of the goals that we need to establish, and we're only looking at 5 goals from 2024 to 2029. Yes.
Just based on the conversation, I would see just a buy-in, because I mean, we're trying to make a county-wide transit. But like you mentioned, there are cities in the county that wouldn't necessarily buy into this. So what do we do to try and develop this county-wide system, but potentially moving ahead without some of those cities that also are the ones that essentially have the jobs and are more affluent. And so the ride system actually seems pretty cool, because if you're a business person, all of us have used Uber when we go business. I mean, there's no shame or anything on that. If you're caught maybe using a bus, that you might be seeing like, oh, is there something wrong, you know, with your car?
Do you think that some of these NIMBY communities, not my backyard, is, I don't want you to dump 6, 7 people at a stop in my city for them to wait for 20 minutes and just loiter around. You know, I mean, unfortunately, it's a mindset. You know, a lot of these bedroom communities are 95% mobile through their own vehicle. And well, you're gonna bring that in my city, that's going to lower property values, because that means that the people are getting dropped off probably can't afford nicer homes, so we have to provide I mean, it's really a NIMBY kind of thing. With this multimodal last mile, first mile, you can get them in and they're not waiting at a bus stop, they're getting dropped off at the place of work. If they're gonna go downtown, or I'll use my bedroom community that I live in, which I would see could be a very NIMBY type of community, would say, well, we need somebody to work at Ziggy's or, you know, the Brew Kettle or whatever, but we necessarily don't want them dropped off at the corner of Route 58 and Cleveland Avenue, where they're all walking, or they're, you know, they're sitting there waiting to come downtown. Or I could see that being, maybe I would use the term obstacle, because threats scare people. Obstacles.
Okay.
Like, what are some of the obstacles? And I think you hit on it when you said people are a little concerned and will not necessarily willing to buy in if they can't see the economic return on investment of being a part of this. But as soon as communities like Amherst realize, hey, all of our businesses can hire and bring in, you know, because there's just not enough people that want to work. I guess in the Ziggy's kitchen, I'm just using for Larry as an example of Ziggy's, but you know, that I think you're right, it's an obstacle. I think you hit it.
Because I mean, you do have communities like Avon Lake, they don't necessarily depend on people that live in Avon Lake to be in those businesses and those, but the commerce there is like booming, so they're getting workers somewhere.
Yeah.
Who are coming into the cities to work in those jobs. So like you said, probably having bus routes around there would be kind of like, oh, another bus route, you know, it's like more visible.
Right.
So doing something like this could potentially be, you know, like a way to bring those communities that potentially, you know, don't want to see it, but know that people are coming from other cities to work there. And then also they might be more likely to use it themselves, because now it's, you know, not like I said, Uber.
Right.
Uber is, I mean, everybody uses Uber, and there's low income, high income, you know, whatever, you just use it for the convenience. So if like your car broke down, like, instead of Uber, I'm like, I can just go to the app and just get me a ride to head over here while my car's being fixed.
Yeah.
Fix the next day.
Yeah.
And I think you start with, like, we are allowed to pay for transportation on LCC. We, like I said, they haven't sent us a bill, but we're allowed to pay for it. So if we're allowed to pay for that, I wonder if we would be allowed to pay for the ride program. And I don't see why, but I also don't have Dan Petticord with me right now. He always tells me, don't commit to anything until you try to pay. And I live by that, but initially I don't see why we couldn't. So if you get organizations like the Veterans Service Commission to buy into that, people tend, the veterans are doing it. Now all of a sudden you have a steady customer, right? No one can say anything bad about veterans. So,
Well, and I think you're getting at the second one, what necessary resources are a cause for concern?
yeah.
And funding is one of them, yes.
I think broadband is a huge one. You have to have broadband to be able to get onto the apps that we need to make all of this work. So I know there's money out there with broadband Ohio. And in our community, there are people that may or may not have access to broadband because they're in underserved populations. So that's a huge, huge concern for us in Lorraine County.
Yes, you're right. And that's why we always need to think about that community and why we cannot strictly, in my opinion, be about being on the app or going on the computer. We always need to have that phone call option for it. But that is a threat because, you know, somebody who's younger than me probably are, all they've known is technology. So they're not gonna, I mean, they haven't seen a dial, have you?
Wait.
So, what areas have there been problems for? That is kind of a general one. But anything else regarding opportunities and threats, I think you really hit on it. You know, I think that what the opportunity that I'm hearing is we don't have to do, it doesn't need to be one or the other. It can be a gradual situation that happens. The communities that, what I see, that if you have a couple of communities like Lorraine and Elyria that want this, and I will tell you, I think Avon Lake wants it too, because they have employers that are looking for employees that want to do something like a ride. Everybody else is gonna start to see that that's successful and want to join in. And then that's when you get, and then when that expo center down the fairgrounds gets started, then you're starting to grow a system. But I think a lot of times we think it either has to be, and that's the only opportunities we had before technology came along. It had to be a countywide system and everybody had to buy in whether they were gonna use it or not. And that was a win-lose situation. And now with technology, it allows us to be a little bit more nimble with the system. And I think that that's great. Anything else, like here's an example, economic development changing, desired destinations, running out of funding for pilot programs. Our county, Lorraine County is the 9th largest county out of 88. And for those of us who live a lot of times in Oberlin, Elyria, Avon Lake, or Amherst, we don't realize how rural our county is and how many seniors and probably veterans live out in those counties that need access to medical, need access to food, and it's not easy for them to walk anywhere in those communities. But any other threats that you can think of?
Can I say something real quick?
Yes.
I'm a huge fan of the micro transit concept. My only concern is we cannot make it a one size fits all. What's going to work for the communities of Elyria, Lorraine, Avon Lake may not necessarily be the perfect fit for the rural communities. And I think there has to be a lot of flexibility and it has to be fluid as to how we roll things out. I don't want to set anybody up for failure and I don't want to overpromise and underdeliver either. You know, if we want to make a positive pitch to the constituents of the county at some point going forward, we have to express that it cannot be a one size fits all, because it may not work that way.
Yeah, and I think we agree with you. I don't think that we were saying that at all. And that's the reason why we were saying that with the technology, it can be a lot of different ways. Yeah, we can right size, it can be all kinds of, because the technology allows us to do that. So I think, does everybody understand that? That we're not, I don't think that we're talking about it needs to be one way or another. We just need to start something. In my opinion. So any other comments on this?
I mean, I think what the gentleman said about the strategic plan for the county, I think it's a good.
So that's a threat that we don't have one.
Yeah. Well, I mean, well,
They're
they're developing.
Or they're developing one.
Becoming an opportunity that we, or let's say we, you know, someone needs to be at that table talking.
And I can bring it up. I'm more than happy to bring it up to them. That's not an issue. I think the biggest thing, and what I would recommend to them, unless, you know, we can do it or someone else can do it. I think a real study needs to be done. Survey Monkey is great, but it's not scientific. It's not, you cannot really reference very well the Survey Monkey questions as hard proof of anything, right? So there needs to be some type of real down in the dirt kind of what are the needs that you can't argue with. And I know, I forget what the formula is, but you can actually sample survey people, and I forget what the formula is offhand, to know, so that you can go to the newspaper and say at a 2 to 3% margin of error, this is what it is in Lorain County. So I'm more than happy to recommend that, because the transportation in this county is seriously lacking for people who want to go to work, for people who need to get groceries and everything else. As far as seeing, I think you also need to approach the issue of transportation as maybe they don't need to go to the store, right? Maybe they need to get with Amazon Prime so that they can have groceries being delivered every so often. Maybe they need to get with, I think it's called Instacart. I don't know yet. That, you know, they could call someone, right? I can't expect a 90-year-old grandma to know how to use Instacart. But if it, like Serving Our Seniors or something else, grandma can call Serving Our Seniors and say, hey, I need this stuff delivered. It keeps her off the road, saves transportation assets for someone who needs to get there, and also gets the food delivered right to her house. So sometimes the need you think is something, but it's really something else. It's not that grandma needs transportation to the store. That's not the problem. The problem is she needs the food. So if you can find a way to get the food to her, then she doesn't need the transport.
Well, I understand that providing various options. We do have some people from some senior organizations here, but I will tell you that what I have also found is that seniors, that socialization piece is very, very big.
Yeah.
And so
You
getting
get
to
out
the
of
grocery store is not just about the transportation. It's about getting out of the house, because I've had calls from people who are like, I'm sitting in my house 24/7 and I'm like, so.
Yeah, and I'm the director of the Office on Aging, and we've tried that. We've tried, you know, bringing the food to them. Here's the problem, all the funders out there, they don't want to do that. They don't want to fund that. You know, we go to transit, we go to transportation. Oh no, we can't fund it, you're not putting them in the bus. Then you go to the opposite. Nobody wants to fund that. So that is another issue that we've run across, is that that flipping the thought on its head is not fitting neatly into anybody's buckets, first of all. But kind of what Sharon was saying is it's not, so for the 90-year-old that, yeah, so I'm thinking of somebody that's, you know, on waiver and they don't get out much anymore. Yes, that's a perfect solution for that individual. But I mean, I'm thinking about 70-year-old, and 75-year-old is that maybe this is their socialization. So my only fear with doing that, I mean, I think that there's a nice balance. You have to find a balance between meeting the need, but not actually furthering the social isolation problem, which actually we could inadvertently do if we get food technology based. So So we have to walk that such a fine line.
Yeah.
But, you know, there's, like I said, there's multiple solutions to the problem. We just have
So,
to wait for it.
I want to get all of you out of here on time, and I know we have at least. No, that's all right. No, believe me, I could stay here another hour and talk about this. I just want to make sure I'm not, holding you guys up. Couple of announcements. We are looking for an intern here, what we are calling a transportation improvement intern to work with me. And so if you know anybody, it's 15 hours a week. Please let them know to go to Indeed, and it's listed there, or contact me. It's a paid position too, yes.
Have you reached out to LLC?
Mm-hmm. Yes.
Send it to me, I have some people over there.
Okay. Also, I'm doing ride-alongs. We have a ride-along tomorrow at 10 a.m. We leave from Meridian Plaza. It's a 2-hour ride, so if you haven't done it, get with me. There's a couple of people who have gone on the bus ride with me, and it's an experience that everybody should have to understand from the rider standpoint what it's like. And then I can't remember your name from Sierra. Oh, you had an announcement you wanted to make too.
Another great time to get to know some of your neighbors and the communities that we all serving. We have what's called a neighbor night. We host Lorraine has one every month. Possibly tonight. We're up in the air about that. At Harrison Community Culture Center, and then the second one is going to be in Elyria at the Urban League. That's going to be on September 14th. There's a flyer out in the lobby area. I'd be glad to see you or anybody else you might want to just come and hang out with us and talk about issues. We could talk about transportation. We could talk about childcare. We could talk about how you had a bad day at work. It's just literally whatever you want to talk about. We do believe that whatever resources are needed are in the room. So this might be a great time to talk to the actual individuals who might need this transportation. We provide, for the Lorraine one, we provide translators, childcare, and dinner. And for Elyria one, we provide all those except for the translators. So definitely we try to hope to get involved with everybody.
So just last, I'll get to, our next meeting is gonna be October 26th at 10 a.m. here. We're gonna be, I need to put all this information together, and at that time, try to find some common themes and then have everybody vote on which themes they think we should be focused on for the next 5 years. So we're going to be putting that together and asking for you to participate in that. And hopefully I will have a draft ready for you to review too. That will be the final meeting, because then we need to send it to the move board for them to review, and then it goes to the commissioners for final approval before we send it to the state of Ohio. And you had a comment too that you.
Well, I had an announcement.
Yes, go ahead.
If this is appropriate.
Yes, it is.
P2R is hosting a fundraiser. We've got tickets. I've got about 5 tickets. It's $30. I've got some information about who we are and what we do for the community. And so I've got flyers, and you can take them with you as you exit.
And when is the fundraiser?
It's gonna be on September the 14th from 5 to 7 at $2. The tickets are $30 a piece, and you got unlimited boneless wings, pizza, mac and salad, unlimited domestic draft beer, wine, and or drinks, and it's
and who's driving everybody home?
Yeah.
You need that vibe. All right. Well, thank you very much for coming. This will be available online if you want to review it again. So thank you very much.